Hi, everyone. Welcome again to the McLean Hospital Borderline Personality Disorder Family and Consumer Patient Education Webinar Series. My name is Chris Palmer. I'm the director of this series. I'm also the director of the Department of Postgraduate and Continuing Education here at McLean Hospital, and I'm a psychiatrist and assistant professor with Harvard Medical School. On behalf of McLean and Harvard, it's my pleasure to welcome you to the webinar today. Today we're joined by Dr. Gillian Galen, who is a psychologist here at McLean, and she is going to be doing a follow-up program, an open discussion on validation. For those of you who didn't see her webinar, it's on our archived site, and you can go back and view that, where she goes into quite a bit of detail about the concept of validation and gives a lot of examples. But today's format will really allow for an open discussion. So we want your questions and your clinical cases and things that you're struggling with. And we're hoping it will be helpful to help you be better validators when that's appropriate. Dr. Galen is a program director for the 3 East Intensive program here at McLean Hospital, which is a program that specializes in treating young girls and young women with emerging borderline personality disorder. She is also an instructor in psychology at Harvard Medical School. Before we get started, just a few logistical announcements. All of your emails and phones have been muted, but we do want a lot of participation. So if you want to participate, you'll see a Q&A box in the lower right-hand corner of your screen. If you want to type in questions or cases, you can do that at any time, and you can even start right now if you've come to the webinar hoping to have a certain question answered, or you're having a dilemma implementing validation and you're not quite sure what to do, or if validation even applies to your scenario. Feel free to type in those questions and we'll put them in queue and get through as many of them as we can. Additionally, we have a lot of hopefully helpful links for you in the lower left-hand corner of your screen. So that first one is a link to our web page. So you can see upcoming webinars there. You can also see all of our archived webinars, including the one that Dr. Galen did on validation. So feel free to visit that site if you haven't visited it already. The next 3 links are resources just about borderline personality disorder in general. So there's a wealth of educational information. That first link in particular, the BPD Resource Center, can be very helpful in terms of referrals to clinicians within the United States. So if you reside in the United States and you're looking for a clinician, that can be a helpful link. I guess it would be the 5th link is for our next webinar, which will take place July 17th. In that webinar, we're going to be joined by a mother of somebody who has BPD. So she is going to be presenting the family perspective of what it's like to have a loved one with borderline personality disorder. She has been integrally involved in the Family Connections groups through the National Education Alliance for Borderline Personality Disorder, and has been really involved in education on BPD. So we hope you'll be able to join us for that. And then finally, all of these webinars have been made possible through a generous gift from a family affected by borderline personality disorder. And if you are in a position to be able to help support these webinars going forward, we encourage you to click on that very last link in that box, and that allows you to give a gift, large or small, and anything will help support these webinars. And so with that, I'm going to turn our webinar over to Dr. Galen.
Hi, I'm glad to be back to talk about validation and hopefully be able to answer a bunch of questions. This is a pretty complicated topic. So I'm going to do just a very, very brief review. Some of these slides are going to look familiar if you joined us for the last webinar. And then we'll be really discussing people's questions and thinking about how to really implement this very complicated but incredibly useful skill. So what is validation? So just sort of a quick reminder, we're really looking at acknowledging and accepting someone else's inner experience, their thoughts, feelings, and behaviors, and we're trying to find what is valid and reasonable and understandable given who they are and the situation they're in. You can think about it as seeing the wisdom in another person's experience given, again, who they are and whatever the circumstances are in the present moment. And this can be challenging because often we have to contend with our own feelings. So we have to sort of step back from how we feel and think about how someone else feels. And we may or may not agree with how they feel in the moment. So what validation is not. So validation is often a confusing topic. Part of it is that the word validation has multiple meanings. But we don't use validation to mean agreement. So again, you're looking at the wisdom in another person's perspective. And oftentimes we have to validate situations that we don't agree with and maybe we don't even fully understand. Validation is not giving compliments or cheerleading or reassuring somebody. It's also not letting go of limits and contingencies and expectations. And I think often people will ask, okay, so I validate and then what? Is that it? I just accept their feelings in the moment. And I'll talk a little bit later more about that. But really, it's not letting go. It actually can be one of your most powerful tools in setting limits and holding contingencies and stating expectations. Because what we know is that if people feel like you're paying attention to how they feel in the moment, they're actually more apt to listen to what comes next. Validation is not teaching. Okay, so validation is really all about the other person's experience. So you can think, one way to think about validation is it's all about them. So I'm trying to get out of my own experience for a moment and see the wisdom in somebody else's, right? And then I come back to holding my position and feelings as well as the wisdom in theirs. So it's not about convincing or teaching or problem solving. It's really about the emotions in the moment. So why is it important? I think most people that once they learn and start to master validation find that this is probably one of the most invaluable skills, interpersonal skills that they can use in their life. This is, can be with your family member that suffers with BPD, but, validation is a skill that works for everybody. And validation can be a gateway to change. Again, so when people feel like their position and feelings are understood, even if they're not agreed with, they are more apt to listen, they are more apt to think about other options and entertain change. We know that validation can support emotion regulation, right? So when all of us feel more understood, we tend to be more regulated. For people with borderline personality disorder, validation really can help them understand their own experience. So that is often an area of deficit for people with borderline personality disorder, being able to find the wisdom in their own emotional experience, emotions that have often been very large or very out of control or very sort of judged. So validation is really a key in helping people with borderline personality disorder find the wisdom in their experience and ultimately for them to learn how to validate themselves and be less reliant on validation from other people. We know validation improves communication and relationships for all of us. And then people listen to more of what you say when they feel like that you understand maybe their position or you've thought about the impact of what you're saying. So why do we invalidate? So often people who invalidate are doing the best that they can. We all invalidate. Even the most skilled validators will have moments where we can be quite invalidating. Our emotions can get in the way. And the world is ultimately quite an invalidating place. So why do we do it, right? So we may simply not know the skill. So some people are just more naturally validating than others. And that just happens to be sort of who you are and your own temperament and what your own experience with validation has been. Many people are often afraid that if they validate a very strong emotion, they will get more of that emotion, essentially making it worse. This is often not the case. However, using validation when people are extremely, extremely dysregulated often is not the correct tool in that moment. We often invalidate when we want to fix things, right? So many people, many of us are excellent problem solvers. And we want to solve a problem, which for some people can actually be invalidating in the moment. So we may have the urge to fix something, which can feel very invalidating, because what the message can be is that this problem that you're having a hard time with is actually easy to fix, even if that's not our intention. We have a hard time validating when we're afraid, when we're angry, when we're resentful. We may not want to validate because we may want to encourage or cheerlead. We may be overwhelmed, right? When we are overwhelmed with our own emotions, it's very, very hard to think about someone else's emotion and the wisdom in it. You might be frightened of the other person's emotion. So you may have had experiences with big emotional bursts that have, been scary or dangerous. And so you may not want to move in to validate someone's experience because you're afraid of what has happened in the past. You may disagree, right? You may have a different worldview than this person, and trying to find the wisdom in a perspective and an emotion that is different than our own can be exceptionally challenging. Or simply when we don't want to accept the reality that is in front of us. It can be sometimes very hard to validate painful emotions with people we care about. So when we do validate, so as we are practicing validation, we need to remember that we do so tentatively, okay? So we always keep in our mind, and this is one of our biggest pitfalls, is validation is not telling somebody how they feel. It's tentatively checking in to see if we are understanding their experience, right? And if they say we get it wrong, we get it wrong, okay? We back off, and we try to be more curious about what we missed. We really want to focus on validating emotions, not thoughts, not statements, and not beliefs. We want to really do the best that we can to think about how is that person feeling, okay? We don't validate the invalid, and there's already been some questions about this. And this is a tricky thing. Sometimes one of the really challenging things with validation is that we actually have to figure out and sort out what are we validating, okay? So things that are not true are not going to be things that we validate. The challenge is we may need to work on figuring out what the emotion is behind those things. So when we validate, we need to remember that there are many truths and many perspectives, okay? And the less emotional we are, the easier that is for us to hold in our minds. We need to remember that the opposite of a truth is another truth. So the opposite of somebody's truth is not necessarily a lie, right? And this is the idea that there are multiple perspectives for multiple experiences. And when we validate, we're open to correction, okay? So we remain tentative. And if somebody tells us that we didn't quite get it right, then we try again. And we ask, okay, I didn't get that right. Let me see if I can understand it. Or can you help me understand it because I'm not getting it? So very quickly, there's, often people say, how do I validate? It can be somewhat of an abstract concept. And so in DBT, they have come up with different ways, sort of different kind of ways that you can validate somebody else, okay? They make them into different levels, but I'm going to ask you to not really focus on the level. There's no real, you don't do 1 and then 2 and then 3 and then 4. These are just simply different techniques of validation, okay? So the first and most basic way that we can be validating is that we can be present with someone, pay attention, and be curious, okay? And be open. So we're not leading them in any direction, but we're putting down our phones, turning off the TV, we're giving them our attention, and we're getting curious about their experience, okay? Another way we can do it is that we can accurately reflect back what we think they're feeling, okay? And this is where you really need to be quite tentative, and you need to ask if you've gotten this right, So did I get it right, after, your long day at school and this conflict that you had with your friend, you're feeling, really disappointed and left out. Okay? And if they say that that's wrong, again, you back off, and it's a wonderful opportunity to go back to number one and ask, okay, I didn't get it. Can you help me understand? The next one is that you can do something called reading minds or guessing unstated feelings. So this is generally considered a high-risk, high-gain validation technique, okay? Because what you're doing is you're using somebody's body language, paying attention to what they're saying, knowing them, knowing their context, and then without them actually saying anything, you're essentially guessing the unstated feelings, okay? So this is one that you have to be prepared for, that if you get it wrong, you back off, and then again, you can go back to number one. So it could be that, somebody comes in the house and they kind of drop their bag down and they, kind of aggressively hang up their coat, and you get a sense that clearly they had a bad day, and before they necessarily talk to you about it, you may say, it seems like, you're really upset or you had a really tough day, which is when you get it right, can feel really good. It can feel really good for somebody to think, wow, someone was really paying attention and they got my experience without me having to say anything. So the next way you can validate is that you can validate in terms of the person's past history. So given what has happened in the past, the way you feel right now makes a whole lot of sense, okay? So, given that you've had a really rough time every time you've changed schools, it really makes sense that now that you're starting this new school, given all that's happened every transition, you're going to be really anxious, okay? And this can be a really powerful tool because it can really help the other person make sense of their emotion. Oh yeah, I'm not just panicked or freaked out for some unknown reason. It all makes sense now, right? School has been tough, transitions have been tough, and here I am, I find myself again in another transition. So this is a really powerful way to validate. Number 5 is acknowledging the validity of the present and how most people would react. And so this is a great way to validate someone who's having a new experience and thinks that their own experience and emotional reaction may be sort of outside of the norm. So I think when people are having a job interview for the first time and they're very anxious, it makes sense, right? Things like job interviews are anxiety provoking for people, right? So it's not saying, oh, everybody feels this way, okay? Because sometimes that can get you in a little bit of trouble. It is acknowledging that given the situation you're in and given that other people have been in this situation as well, and in general, it could be a, anxiety-provoking, scary, sad, whatever it is situation, your response actually fits the situation, okay? And the last way is to just simply be radically genuine. So to be with someone and be present, it can be handing somebody a box of tissues. It can be sitting with somebody and, getting teared up with them without a whole lot of talking. It's really about bringing your own emotional experience with you and using that to support them. So people often ask, how do I know if I got validation right? Typically, there's some really nice, clear indicators to let us know, like, are we on track? Are we in the right direction, or are we not? Sometimes people will simply tell you, which is great. But often when we get validation right, you will see that the emotional intensity goes down, right? So the people feel a sense of relief and of being understood. Maybe fast talking and intensity, again, things start to slow down and kind of become more manageable. And often when we get validation right, we get more information, okay? So people will start talking. They'll start telling you what's going on. They'll start giving you more information about the situation. And when we get validation wrong, we tend to get one of two sort of extreme reactions. The first one we get is an emotional eruption, right? So the emotion actually gets worse, which doesn't mean that validation causes an increase in emotion. It just means we didn't quite get it right. Or the opposite of that is you will get a complete shutdown. So all communication will sort of cease, and you'll just get somebody that's very shut down, very kind of unwilling to continue communication. So the great indicators for us to help keep us on track. So the barriers to validation are not practicing. Validation is a skill like all of these skills. We have to practice it. Some people are better at it than others. It's something that you want to practice in low-intensity situations, maybe with people that are easier, maybe more forgiving in your life so that you can use it in those more high-intensity situations. Believing that validation is time-sensitive. Okay? Often people get stuck saying, oh, I should have validated in this moment, and now I missed the moment, and I can't go back. The wonderful thing about validation is going back to somebody and saying, it seems like it was just a really hard day for you yesterday, is validating in and itself. Because what it means is wow, my experience was important enough that you took some time to think about it, and now you're coming back to it. Okay? Judgments get in the way of validation tremendously. Fear, being exhausted, overwhelmed, burned out. Blaming yourself for other people's problems can make it incredibly hard to validate them. Holding on to past hurts and disappointments in those moments can make it very hard to validate. And of course, history always makes it hard to validate. So we'll go ahead on to questions at this point. So the first question that came in was, what is the difference between agreement and validation? So I talked a little bit about the fact that they're not the same. So, and in fact, often validation is the key tool when we are in disagreement with someone else, okay? So validation, again, it's seeing the wisdom in the other person's perspective, which you may agree with or you may not, okay? So validation is thinking like, okay, so we have two very, very different opinions. What makes sense about their opinion? What makes sense about how strongly they feel, okay? So you may agree with somebody and be validating their experience. It may be a very familiar experience to you. Or you may very, very much disagree with how somebody reacted. They might think, wow, that person was really mean to me. And you might think, actually, that person wasn't that mean. Maybe they were just having sort of a bad day, or maybe you were having a bad day, okay? And so your task would be then to validate that person, that, whatever that interaction they had must have really felt bad to them, okay? And then you can, if you want, you certainly can agree with it, but you don't have to. So the next question, there was a little bit of background, but I'm going to skip down to the question, which was, can validation overpower mistrust and misinterpretation? So this is really an excellent question, and this is can be one of the hardest situations for parents or partners or friends to validate, because you're caught here. You don't want to validate the invalid, okay? So actually, it's not about validation overpowering mistrust or misinterpretation. It's about you really moving in and validating the fact that, there has been history, there has been mistrust, that there has been misinterpretation. So the challenge with validating these kinds of things is that we have to step back and we have to think about what do they feel happened? What is the wisdom in their belief that mistrust happened or misinterpretation happened? And that's then what we go and we validate. And so if the person feels like genuinely you are seeing, okay, yeah, this did happen, we are all doing the best that we can, and, we made mistakes, we had miscommunications that maybe did lead to things like mistrust and misinterpretation. You got to see the wisdom in it. At that point, you may find that you have gained some more trust. So in that case, maybe it does overpower it a little bit, but you want to really see in these situations, how are they right? From their perspective, how did this happen? And this is where we have to really take an incredibly non-defensive stance, and think about, okay, so given who she is, and given her emotional sensitivity and given her history and maybe given, my history or my reactions or, what has happened within our family, okay, is there wisdom in the fact that there was a loss of trust and that feeling is real and valid. And at that point will be your opening to start to think about, okay, how do we change that, right? Because if we can't acknowledge it, then it becomes very, very hard to do anything about it. Now, certainly you don't want to be validating the invalid, and I think that, paranoia can be a very challenging thing. So, I think you have to validate that is the way that she's feeling, and so that's not something that you're going to do. So this question was, how do we validate our loved ones to support them in their achievements and not be too overpraising so it becomes unhelpful? What is the synthesis between these points? Can you give examples of what to say in these situations? I'm so proud of you. Appropriate, or in some instances it is unhelpful? This is also a really excellent question. So there is praise, and praise is one thing. There's praise, there's cheerleading, there's reassurance, which certainly can be useful. They also can be complicated, right? Because I think where praise can get tricky in the context of validation is that if you are praising somebody for something that they are not proud of, even if it seems like they should be, even if you lined up 100 people and said, if this happened to you, would you be proud? And they said yes. If the person isn't proud of it, you actually can be invalidating. So if, and this is often a common thing that happens with people that are very perfectionistic, is that they come back and they've gotten an A- on an exam or a paper or in a class, and they're actually disappointed. They're disappointed because their feelings and beliefs are that they should have done better. They should have gotten an A. They should have gotten higher in the 90s. They should have gotten an A+, whatever it is. That when we praise, again, because we may be proud of them, we're actually in our own emotional experience and we're not in their emotional experience, right? So then what we have just sort of told them is, well, we're really proud of you and this is really great, and they feel awful. And so we have invalidated them by really missing the mark about what their experience was, right? And so these are tricky situations because really in this case, the validating thing to say is, you look really disappointed, okay? And that can be extremely hard, but that is what their emotional experience is, right? Is that we're excited about it and they're disappointed about it or embarrassed about it. Or angry about it. So, I think there is a time for praising, absolutely. And you have to be really mindful about, are you praising them because it is your feelings, which is fine, right? And then in those cases, you would mark it, like, I'm very proud of you. I think you did a nice job. And it looks like you're pretty disappointed, right, is the validation piece. For people with borderline personality disorder, the idea of being proud is a complicated one. So it's really about knowing your loved one with borderline personality disorder and knowing if praise is helpful or if actually praise sort of causes more upset. And you can usually tell. The key is that when you praise, if they shut down or get upset, you've missed the mark, and so you need to step back and remember you may be proud, and the synthesis is their experience is not the same as yours. So, and this is a tough experience for them. This is a difficult thing for an A- could be extremely difficult for somebody to accept.
So, Dr. Galen, if I can interrupt before the next question, because I want to follow up on that last one in terms of praise, because I think another common scenario is when a parent sees a child, for instance, and this child is just kind of viciously beating herself or himself up. So I'm so worthless, I hate my life, I'm so stupid. I can't do anything right. Nobody's ever going to love me. Why should I even be alive? And my sense is that some parents want to counteract that with praise. So they want to counteract that with, like, that's nonsense. You're beautiful, honey, and you're so smart. Look at the A- you just got in school the other day, and I'm so proud that you could do this, or I'm so proud that you're going to therapy and participating and trying to get better, and I'm proud of you, and I wish you could be proud too. But it's really kind of almost a knee-jerk reaction or a defensive reaction. Like, I don't even want to go, and I don't want to even try to validate all of those horrible things she just said. Like, instead, I want to counteract that. I want to tell her she's wrong. That's none of that's true. You're wonderful. You're lovely. I love you to death. I do not want you to kill yourself, and you're wonderful. And then I'm going to pour on the praise, hoping that will help.
Right. So this is an excellent point. And I think, would show up with anyone, because I think when you hear a loved one talk so poorly about themselves and be so hopeless and so unhappy, I think the knee-jerk reaction is to do a lot of reassurance. No, you're wonderful, you're great, and I'm so proud of you, and your dad's so proud of you, and everybody is, and you have friends, and everything is great. And the problem with that is that actually what's really happening there, you'll generally see in those cases the kids will shut down or they'll get really mad, right? You just don't understand, and that will be the end of it. Or you'll get a lot of silence. And I think, this is a great example of one of the challenges of validation, because often we're doing that reassurance because for us, so the first thing is it feels so awful to hear that, and we think, oh my gosh, I have to counteract this in some way. But ultimately, we've totally missed the mark about their own experience. So when they're saying all these things, and at times they can be quite scary, the things that they say, I don't think I'm worth living anymore, I'm never going to be in relationships anymore, that is not what you're validating. So you're not saying, oh yes, all of that is true, because often a lot of it actually isn't true at all. But it is what their emotion mind is sort of doing right now. It is how they feel. So your real challenge, and this is where you can combine two things, where you want to mark what you feel as your own, and you need to synthesize it by holding their experience at the same time. So you may say something like, that is an awful way to feel, and, I don't agree with a lot of that stuff. I do think you are, and then you could pick out some of those things. Because I think one of the challenges is that we also get into the pitfall of believing that reassurance is going to actually change the way somebody thinks. And really what we know about reassurance, it's going to be okay, you're really great at this, this is going to work out, you'll definitely get into college, A's and A-minuses are fine, you don't need A-pluses. The problem with reassurance is it doesn't actually last. So it's actually, it becomes a very dangerous habit to get into. Because one of two things happen. Either people get very dependent on reassurance and they come back to you asking over and over again to help them feel better. Or, it just sort of turns them away, and it feels like, well, you really don't understand my experience. And really what we know about the brain is that reassurance works quite well with young kids when they don't have the cognitive structures yet to believe anything other than like their parents can solve the problems, and then they get to, somewhere around, 5, 6, 7, and they realize that parents can't protect you from all bad things that happen. Parents can't tell the future, and so once we become older, that kind of reassurance actually can be somewhat detrimental, even though it is that gut instinct. And the idea of moving in, again, regulating your own emotions and being able to say, that just must feel awful. Again, you're not agreeing you're a worthless person. You're not agreeing you're never going to go anywhere. You're never going to agree that your life isn't worth anything. Simply what you're saying is, look, I acknowledge that you feel this way right now, and it's a horrible way to feel. And you want to add that and, here's your synthesis, and that's not my experience of you. I don't, I think you add a lot of value or whatever. And then, you pick a couple things. But you want to mark it as your own, and you want to make sure that their experience is captured too.
Great. I think that's a very helpful clarification.
All right, so the next question is, what is the best DBT approach when your teen has a number of projects or chores to do and they are frozen with emotional overload? For example, if it's her weekend to sweep the house and she has schoolwork and rehearsal, but she's agreed to do her chores, how do we respond if we discover she hasn't kept her part of the deal? And what point is it appropriate to set boundaries or consequences or discipline her? So again, these are great questions. And they often come up with validation. And again, it's that like, okay, so we validate and then what? Or and I think often, parents and siblings can get really stuck, and it can actually breed a whole lot of resentment if we just stay with simply validation and no change. Remember that we can think about validation as a way to get to change, okay? So, and it's not about giving up boundaries or consequences or discipline, but one of the ways to do it is if you've set an expectation and she has said I'm going to do it, and things came up that weekend around emotional overload, your task is really to validate the emotional overload, right? Seems like whatever went on this weekend was really stressful and hard, and it was difficult to get lots of things that you had said done, and then you got to use that and that's where your synthesis comes in, right, with acceptance and validation and then a little bit of change, and we discussed that, you were going to do your chores. This weekend you were going to sweep the house. How are we going to get that done? You may ask, how can I help you get that done? But that was the agreement, and I'd really like you to keep it. That would be really important to us. So I think, again, and this is where you're going to use your own judgment too. There may be times in which you don't hold the boundary or the consequence. Maybe you negotiate that the sweeping gets done later on in the week, or you exchange the chore for another chore. There may be times in which you assess whatever happened and your child's capacity, and you don't hold the line. And then there's going to be other times where you do consequence or discipline. So, I think this is a challenging one because there's a lot of different factors that you need to take into account. But what I want to really hit home is that validation is not letting go of those boundaries. There may be times where you have consequences in place, or generally it's a consequence. If you do this, if you get your chores done, then this happens, and if you don't get your chores done, this happens. So I think if you have set those consequences or expectations or contingencies, whatever you're working with, you do want to hold them. Even under the sort of emotional overload and difficult situations, because one of the things people with borderline personality disorder are often contending with is what we call mood-dependent behaviors, meaning when their mood is good, they can get lots of stuff done, they can make lots of commitments, they can, sweep and do whatever chores they're doing, and then when their emotions shift and they're having a harder time, then all of a sudden they can't get anything done, right? And so that's a behavior that we're going to actively target. And we do so through contingencies, right? We set them up in advance. And then the consequences of not following through are known. That being said, nothing is absolute. But I do want to really hit home that, just because somebody with borderline personality disorder has like a difficult weekend doesn't mean that you let go of consequences. But it is really helpful to set those consequences and contingencies up in advance, which it looks like this person did.
So can I push a little more on this?
Sure.
Because I think this is a great scenario, and as I think about a lot of patients and families that I've worked with, it brings a few questions to mind. So one assumption that I think a lot of us have in terms of just almost an intrinsic feature of borderline personality disorder is that people with borderline personality disorder are often much more sensitive to rejection than maybe others.
Yep.
So they have this heightened rejection sensitivity, and they're much more likely to have strong emotional reactions to things, including discipline.
Yep.
And so I think a lot of parents have found over the years that, like, oh my God, I'm burned out. I'm exhausted. Like, I can't, like, disciplining is drama and chaos, and it's clearly unpleasant for my son or daughter, and it's really unpleasant for me too. And like, why do I keep doing this? Because it's not getting better anyway. then, like, why am I even bothering, and am I just making the situation worse? And so as I read through, even to come back to this example, as I read through this example, I'm imagining that the parents might be in a position where they say, okay, we've discussed the consequences when everything was calm and she was in a good place and she said she would do her sweeping, and now we're going to implement the consequence, and we're going to say, honey, we're sorry that you had a really busy weekend and that you've signed up for a lot of things at school, and maybe school's a little more challenging right now, and we get it, but we're also a family, and school's one part of your life, but we're also a family, and we have expectations for everybody here. And one of the expectations was you were going to sweep the floor, and you didn't sweep the floor, so you know that this consequence happens. You're grounded for a day, or you don't get an allowance, or you don't get something, and then she completely blows up.
Yep.
Oh my God, you don't understand me. You do not get how hard my life is. You don't know what you're talking about. You just don't even want to understand me. I hate my life. I hate myself. I can't do anything right. Everything I do just gets messed up. The people at school hate me. They think I'm an idiot. That's why I was trying so hard on that homework. And now you think I'm just a lazy slacker because I won't sweep the floors and nothing's going right and I'm sick of it. I should just kill myself. And so the parents trying to implement a consequence, and now they're dealing with that. And so a couple of questions is, do you have any recommendations for, do you validate, so let's stick with the theme of the webinar, do you validate that intense emotional reaction that you had already just validated? You had just validated not 1 minute ago, but you gave a consequence for an expectation that she failed to deliver on, and now she is emotionally dysregulated, beating herself up, furious at you, but more taking it out on herself. I'm disappointing everybody. I'm messing up at school. I can't sweep the floor. Everybody hates me. And like, I just want to die. Should the parent validate that emotional outburst?
So I think you can validate. So I think that the biggest pitfall is not following through. So I think that is backing away from that and saying like, oh, I understand this is horrible. Like, you don't have, never mind, forget the consequence. So I think that's probably the biggest pitfall and the worst thing to do. I think, yes, I think in those moments you have to find the wisdom in that outburst, which is really hard. So you're not going to validate that you're a failure. You're not going to validate that you can't do anything, because it's not the case. It's not that she can't do anything. It's that this weekend she didn't balance whatever she needed to balance, getting her homework done, getting her chore done, dealing with using the skills that she needed to manage whatever emotions happened, whatever conflict happened. So I think, your task is to sort of take a deep breath and to stay really, really steady, and to validate something. Like, I get it that this is really hard. This is disappointing. Maybe the outburst is there because actually you haven't held the consequences before. That this feels new. I understand we have not held consequences here before, and we set up these contingencies and consequences together, and we need to follow through on them. So I think that is your task. Now, she still may run out of the room and storm out of the room, and then you do have that, that worry around safety, and hopefully, you guys are able to either navigate that, or there is some discussion that has happened when you are setting up those contingencies or boundaries, or the discipline or expectations, that should a response like this happen, if you make me do this, I'm going to kill myself, or that you have a plan as a family about what to do. So parents, what happens when that is the response? Typically that can be an extinction response, right? So all of a sudden parents are doing something they haven't done before. hold the consequence and hold the line in the context of a big emotional outburst, okay? So those are things to be prepared. If you are changing your behavior, meaning like holding the line when typically you would have backed away from it, they are going to have an extinction burst, which means they're going to have a very, very, very strong reaction, and you need to be sort of ready for that reaction. You may validate, and the validation, depending on how big the reaction is, may go in or it may not. It may be that you come back later when things have settled and you validate how hard it is that we did something different as a family. We held the line in the context of you having a really, really hard time. We held an expectation that you would be skillful. And that was hard because it is hard. You know, if the history is when I have a big emotional reaction to something, the consequence changes, or the expectation changes, or the responsibility changes, then I'm not necessarily going to be prepared when you hold that line, even if I was part of the discussions about holding the line. So really your task is then to figure out what you validate in that outburst, but it is not validating the statements, okay? That is the pitfall. It's not validating my life isn't worth living, I'm a loser, I'm stupid, I can't do anything right, I fail at everything. It is what is the emotion behind that, right? And if you're not sure, you can use a little bit of those sort of generic words like, this is really hard. This is really, really hard for you, you know? And if you're worried about them feeling like that if you say anything validating you believe them, then you can say, this is really hard for you, and, you know, I don't believe, actually, those things that you said. I don't believe that you're a loser, and I hope that you will use those skills. I hope that you'll follow the plan for getting yourself regulated. You know, I hope that you can keep yourself safe. You know, and then, you know, I think if you have real worries around threats around suicide, then, you know, you have to have a plan with your outpatient team to think about, you know, what do I do as a parent when my child is making these kinds of threats, you know, and how do I assess, is this part of a big extinction burst in which you know, sort of I'm pulling out everything desperately to get you to change your mind, or is it something I have to really be worried about, and then what am I going to do?
Great. No, that's really helpful.
So the next question, my 29-year-old daughter, who I've been estranged from for about a year, has accused me of many things I did not do. We are hoping to do family therapy soon. How do I address these false accusations without her shutting down? In essence, how does one validate false accusations? So this is also a really important question that comes up a lot. And the first piece of it is actually so false accusations fall under the invalid, okay? So we would not validate the false accusations, right? So if somebody is accusing you of doing something that you didn't do, you would not agree that you have been doing them, sort of in the, you know, that's not going to get you anywhere. What you really have to do is think about, okay, what are the feelings here, right? And, you know, one of the feelings could be that it's really hard that something happens in the communication where you guys can't agree on what happened, right? I don't know exactly what the accusations were, but that the validation is, you know, that maybe this is something we have to talk about, and it's going to be really hard to talk about because we haven't figured out, you know, why we come to such different conclusions about what happened, okay? So you want to, with false accusations, you have to recognize that for whatever reason, she has her own experience and her own feelings about it, and you have yours, and that they are not matching, right? And how hard that has been for both of you. You know, and you may validate how hard it is that this may not be something that you guys can figure out or haven't been able to figure out on your own. So you want to really stick with the emotional experience for both of you. And again, that's going to be that synthesis. How do, especially with things like false accusations, how do you say, okay, a false accusation really is that we have she's accusing me of doing something that I'm saying I didn't do. So we have two very, very different experiences, opinions, beliefs, whatever it is. So, how do I validate really that she feels very strongly one way, and it's really hard that I don't, that we can't come to terms with an agreement here, or that an understanding, or how misunderstood she must feel, right? So this is a real challenging one, but the way to really to think about it is to think about what these feelings are around making accusations that are not validated by the other person. And you can certainly talk about your own feelings about maybe you guys not being able to have a shared experience about things.
Great. So we have several other questions that have come during the course of this webinar, and we have a few duplicate questions. So the first one, two different people have asked, what do you do in the situation where, I think both of these are cases of parents with a child who has borderline personality disorder, but what do you do in a case where the person has shut down and basically doesn't seem to want to communicate with you, doesn't really respond much at all, doesn't open up, doesn't share a lot of their experience anymore?
So I think, validation around shutting down, along with validation with kids and adults, just people that tend to maybe internalize more, where it's actually harder to see. So when you have sort of big emotions or obvious emotions, it's actually easier to validate. It can be scarier, but at least you can see what's going on. Validation around, and again, it depends how shut down somebody is. I think what you can do around someone very shut down is you can acknowledge it, right? You can acknowledge that they're having a hard time, and maybe you wish you could help, or but really, I think often the thing is that, I can tell you're having a really hard time and I don't understand what's going on. I'd really like to know, so when you are ready, I'm here. Let me know if I can help. Is really sort of the best that you can do, is that you can acknowledge that certainly someone is having a hard time. When they're really shut down, I think you want to be careful about assuming what it is. It can look like somebody's stubborn. If they're shutting down, like in a therapy session with you, it can be very frustrating. And it can be very easy to assign a lot of intention to their behavior. And I think your task is to be non-judgmental, to pay attention to thinking about really that the experience of shutting down is probably a pretty uncomfortable one. And to just to recognize it, to recognize that something is going on, you don't understand it, you'd like to understand it, or you would like to be helpful, and then you really make yourself available when they're ready. I think that's really the best you can do.
Okay. So we're going to move on. A couple of people have asked another question, and I'll go ahead and pose the question, but my guess is that I think that some people think of too much validation as leading to this problem. So two people have asked, what about people who seem to just rely on or come to expect constant reassurance, constant praise from other people, and I think they would rope into that constant validation. Mm-hmm. So people who have really an extraordinary need for external reassurance, validation in order to stay regulated or in order to produce anything at all, even small tasks that really shouldn't necessarily need praise or a thank you or validation, like the example we talked about earlier. You sweep the floor on the weekend when I'm sure the parents are like running around to the grocery store, making dinner, unloading the dishwasher, doing laundry, doing everything else, and they're of course getting no thank yous for that. And are they supposed to go, oh, thank you so much, dear, for sweeping the floor? But so two people have asked, how do you think about those people, and what are some maybe possible solutions, or what would be needed to help those people move into maybe a more mature place or a more realistic way of being in the world?
Right. So it's a great question. So there are people that become, I think there's often people before even validation shows up that become overly reliant on things like praise and reassurance. And you can see the problem with it immediately is that it doesn't go away, right? So if it worked, you would praise them once, and that would be the end of it, right? The problem would be solved. But part of the flaws around that kind of reassurance is it actually doesn't hold for minutes, really, is all it holds for, and then people need sort of more and more and more. So the way, typically when kids that are, and, people are learning about validation and maybe feeling more validated for the first time, they like it, that it feels really, really good. And so there can be an early part in treatment where they want the whole world to be much more validating, right? And they'll sort of be in treatment and be very validated. They'll go home and they'll sort of point out, oh, that was invalidating. Oh, that was invalidating. Oh, you have to validate me more. And really that phase of treatment should be relatively short. People that are demanding lots and lots of validation, they haven't generalized that skill. So often what we're talking about in DBT is we're talking about learning a skill, and then really it has to be generalized to all different environments of your life. So with validation, it means you learn how to be validated, you learn how to validate other people, but ultimately you learn to validate yourself. So if that isn't happening, that generalization to being able to do more self-validation isn't happening, you often get that continued reliance on the environment, the people around you, to validate you. And that's a real problem with a skills generalization. So they've got the concept, they like it, but they haven't learned the skill of self-validation. So really, when I'm working with people that are in that place, our real focus is on self-validation. How do you give that to yourself? How do you stop looking for the environment? Because the reality is that most environments are not terribly validating. It's hard to find a job where everyone is validating you all the time. It's hard to go to school where you're validated all the time. It's hard to find a peer group where you're validated all the time. That if those of us who understand validation think about it, we validate ourselves all the time. People with borderline personality disorder actually really need to explicitly learn this skill of validating themselves. And in this situation, it's sounding like these people haven't gotten there yet. So the focus would be actually, if I was working with them, would be to try to limit actually the reassurance that was happening. Certainly the reassurance and the praise, what I would want to do is actually limit that in the environment and make them rely more on self-validation. I think validation from from family members around our feelings, that's okay. That's an okay thing. You have to be worried about being told too much or, people starting to tell friends and bosses that they need to validate them more because, it's a little bit psychobabble and that doesn't really, people don't know what they're talking about. So if I was working with somebody that was struggling this way, at least within the family system, I would try to eliminate excessive praise and reassurance. And start to teach and work with the patient around, in those situations, how do I validate myself? How do I get settled and find wisdom in my own experience and make it be okay without getting reassurance from the environment? Now, certainly validation from family could be there because you could actually validate how painful it is when they come and ask you for reassurance. And you say, I'm not giving reassurance. We've already talked about this. This is one of those things that doesn't work, right? I'm not going to we already decided we're not going to keep doing the very thing that doesn't work. So when you ask me, do I look good? I'm actually not going to respond. And there's your validation opportunity right there. It's like, and I know this is really hard because we've done it this way forever, and it must feel really uncomfortable that all of a sudden I'm not reassuring you right now.
Great. No, I think that's really helpful. So another question, how do you think about validating someone who reports kind of feelings or thoughts that don't seem to match their behaviors or facial expression? For example, person says, I'm really sad about losing that job, but they're almost smiling as they're saying it, or they just seem really disinterested in it. So when you kind of feel like there's a mismatch.
So I think often the mismatch comes from this concept of masking. So there are often people that have they have one internal experience and one external experience. There's other people that have sort of nervous and anxious kind of smiles, or have sort of lost the capacity to connect what their emotional experience is with their facial expression. And that can be for a lot of different reasons. That can happen if certain emotions they felt like have been judged by people in their environment, or sort of not supported or invalidated. So I think when you are, validating something like, talking about it, really being upset about losing a job with a smile on their face, I think you can validate that, losing a job is really hard. You could say, and, I'm just noticing you have a big smile on your face, because I think one of the biggest problems with masking is that it actually makes it very hard for people to validate. So they tend to not get validated as much as they would like, for understandable reasons, because people can't read them, right? So often we validate people because we get a sense of how they feel based on what they're telling us, and maybe facial expressions, and we get a whole sort of package of information. And people that mask like that, people find it very confusing. And so they tend to actually validate those kinds of experiences less. Some people find it very off-putting, or they would say it's annoying or disingenuous. But I think it's a real problem in borderline personality around masking. So I think your best bet is to go in and validate the emotion. Certainly that's not a very hard one to validate. It's awful to lose a job. That is something that I think most people can sort of get their arms around. The pitfall is moving into reassurance. You'll get another job. It's not, this isn't the end of the world. Like, you only work 15 hours. I'll help you find another job. My friend has a store, whatever it is like that. That's your pitfall. And maybe way later down the line, you might ask if they want some help getting another job. But really your task is to validate what is there. And you certainly can point out the inconsistency, and it's sort of surprising to see you smiling while you're telling me something that understandably is distressing, stressing you out, making you sad, making you angry, whatever it is. So I think you validate the emotion that's there that makes sense to you. And certainly if they say, well, I'm actually really happy about it, you back off and you say, okay. But if that's not your sense, then you certainly can really gently, very non-judgmentally point out that there's an inconsistency and that actually is kind of confusing for you.
No, I think that's really helpful. So with that, we are at the end of our hour. So I want to thank you again, Dr. Galen.
Thanks.
It's been really helpful, I think, for a lot of our viewers. And I want to remind everybody we've got another webinar coming up on July 17th. You see the link to register right in front of you. So we hope you can join us for that. And